An investment in early learning equips all children, especially our nation's most vulnerable, to succeed in school and sets them on a path to graduate both from high school and college. Your work at the Centering Healthcare Institute to offer better education and healthcare to some of our most vulnerable families will help to improve their life chances.
And if we can take advantage of the kind of pioneering success that Centering Healthcare has achieved and extend that and amplify the roles of patients as participants and guides to research and as guides to the processes of care and improving the way care is delivered and making sounder policy for healthcare, then we truly will have moved beyond the Affordable Care Act to a patient-centered healthcare system.
So we've been talking here for 2.5 days, and we've been talking for 10 to 12 to 14 years about a model really that disrupts the way that care is delivered, that totally turns systems inside out, and that we have seen again and again that makes it difficult to bring something that on the surface, as early on, Rima said to me that the obstetrician who's the head obstetrician I think in the Army said, oh, it just passes a common sense test. Of course, why would we want to do care this way? And we have gotten again and again and again the reassurance from the women that we serve that this is just a better way to get care. And we have seen the transformation that has happened in the lives of individual women as they receive care in the group and as they reach out to each other. And the transformation for us that has happened as clinicians and as staff, that wanting to have, as was said earlier, we want to have joy in our work. The day the physician called me and said the first thing I want to say is, this is the one thing in my week that brings me joy. We want to have joy. We want to be happy. We want to feel fulfilled as well in the work that we're doing. And this is a model that has demonstrated again and again the power to do that for us. It's disruptive. It's hard. And one of the things that I have heard again and again from many of you here is, I'm so glad to be here, to be among my people who will energize me and renew me again, because we know that we often have times of discouragement. And I must say that my personal one has been, can we really have sustainable change, create sustainable change in our systems to support a different kind of care, to support group care? Can it be sustainable? We default so quickly. So we have lots of challenges that we continue to work on, and at CHI we're continuing to do things that will help us to reach our mission of having centering available to any woman who wants to get care this way. It's a big, daunting job for all of us, and we're working really hard at that. But I just want to thank each of you for your support and for your tremendous engagement in this conference. I mean, it's been wonderful. So many people have come to me and just said, oh, the energy is so wonderful. The atmosphere is so positive. And this is important for us as a staff at CHI, for us to get re-energized as well. And hopefully you will go home and you will continue to be 2 inches off the floor with a big smile on your face saying, this is the most wonderful thing we can do, and we need to congratulate ourselves for doing it, and to look at how to get more and more of our mothers into care. So go home, continue to transform care through disruptive design, stay in touch with us, and we will just continue to build a better system of care, patient-centered, patient-engaged, for all of the women and the families that we are working with. Thank you so much.